Hi, my name is Samantha Skaar, and I'm going to talk about the pros of ABA and DTI. Discrete trial instruction, also known as DTI, is the act of teaching a child to respond to specific environmental cues to improve their response in a very circumscribed set of conditions. DTI is frequently confused with applied behavior analysis, and while they belong to the same family, ABA typically involves a more wide range of conditions that will produce a high number of successful behaviors in various environments. The skills learned in DTI will need to be generalized to other situations in order to accomplish the goals present in ABA. DTI can be arranged in many different ways to suit the child's needs, but it will always have four main components: a discriminative stimulus, which is the instruction, a response, a consequence, and an intertrial interval, which is just an extremely brief break. Throughout the intervention, there will be a supervisory clinician with a master's or doctoral degree, as well as experience and formal training in the field of behavioral analysis. This experience will typically be a certification from the Behavior Analyst Certification Board, ensuring a minimal level of educational attainment in specialized coursework, fulfillment of specified fieldwork, and sufficient supervision. This person will oversee all of the components of the teaching programs. There will also be direct care therapists who will work with the child several times per week for 2 to 4 hours. DTI intervention is incredibly intense, which leads to its success within young children. The instructor must be able to have control over the teaching environment. They need to sufficiently understand the child's skill level so that the child may gain access to reinforcers. Maintaining child motivation will likely be the most difficult part of intervention, but also critical to the continuation. The intervention goals will be tailored to fit each child's individual needs and are guided by typical developmental sequences. There are 7 conditions that apply to all forms of ABA treatment. Treatment may begin as early as 3 to 4 years old. Intervention will be intensive, ranging from 20 to 40 hours per week, as well as incidental teaching and goals during all waking hours. Intervention is individualized and comprehensive. Multiple behavior analytic procedures are used to develop an adaptive repertoire. Treatment will be delivered one-to-one with gradual transition to group activities and to natural contexts. Treatment goals are guided by normal developmental sequences, and parents are trained with different expectations to become active co-therapists. The most important aspects of ABA and any intervention for children with autism will be the benefit to the child. In an efficacy study completed by Ortega et al. In 2009, they looked at various studies and their effectiveness. Over 11 different studies and 172 participants, there was reported favorable effect of the intervention for receptive language performance. This was also true for an expressive language skills analysis over 10 studies with 164 participants. In 11 different studies where communication, daily living skills, and socialization were assessed, all of the studies reported favorable effects of ABA intervention. The results of various studies suggested that long-term, comprehensive ABA intervention leads to medium to large positive effects of intellectual functioning, language development, and behaviors in individuals with autism. All of these positive performances have led to giving the children a greater chance of integrating into mainstream schools without additional specialist supports while maintaining gains in the follow-up periods. Another important aspect of selecting an ABA intervention for a child is the benefit that it will have for the family. Parents and siblings are highly encouraged to be active in the intervention process so that behavior management can be continued even when the therapist is not present. In a parental study by Grindle et al., 86% of the mothers questioned reported that additional support in the home is a positive feature of the program, as therapists were there to help with behavior problems. The time when the therapist was in the house allowed for the parents to complete a variety of household chores or to just enjoy recreational activities. These elements allowed for the family, specifically the mothers, to experience less stress as they work through the intervention program. Another benefit to having ABA done in the homes is that both parents and siblings are able to learn how to use the behavior techniques by observing the therapist. This was especially beneficial to the siblings who enjoyed being involved in the therapy sessions to learn successful modeling styles. All of the parents that were surveyed said that their relationship with their child had improved, markedly due to the improved communication skills and the child's improved ability to express affection. This also carried over to the siblings that showed a relationship strength increase due to the fact that they could be like every other set of siblings and play together. It should be noted that throughout all of these studies, there were no control groups due to the fact that it could be considered unethical to not provide a child treatment in order to try and elicit a control sample. The final important factor in a study done by Symes et al. In 2004 is that the therapists that are conducting the intervention have confidence in their own skills and efficacy of the intervention. The perception of themselves may be the most significant barrier in the effectiveness of the early intensive behavioral intervention. As the field of ABA continues to grow, there will be more parents interested in using this as their primary intervention for their child. It'll be important to let these parents know that they cannot expect their child to reach the normal level of functioning. They should have an accurate and realistic understanding of the treatment efficacy. Parents must be willing and be able to devote the number of hours necessary for this treatment. We must also remember that due to the variety that exists within the umbrella of ASD, not every treatment will prove effective for each child. Thank you.